Welcome back to the Dart Center's Reporting at COVID-19 Conversations for Journalists. This is an ongoing series designed to enhance all of our reporting at this unprecedented global moment. We are going to be talking with a variety of journalists and subject experts twice a week for the duration of this crisis. These conversations are being carried on Zoom Live, also I believe on Facebook Live, though that may or may not be the case. We've had technical issues with that in the past. They're also being archived and will be available for future use on the Dart Center website. In addition, my friend and colleague Susan Kaplan is on this call and is collecting ideas to put into ongoing tip sheets and other resources that the Dart Center for Journalism and Trauma is creating. As you know, the Dart Center for Journalism and Trauma is a project of Columbia Journalism School. We are funded by the Kenneth B. Dart Foundation. This series is also co-sponsored by our good friends at Columbia Journalism Review. Okay, so this week's installments of the Reporting and COVID-19 series have focused on learning from past pandemics. On Tuesday, we heard from documentarian and independent journalist Caleb Hellerman, who as a producer for CNN and Sanjay Gupta, and as a CDC fellow, covered or was engaged with every major pandemic in the last 20 years as a health and science journalist. Today, we have a different kind of conversation. I'm very happy to have my friend and colleague and past Dart Center Ochberg Fellow, Jina Moore, here. Jina is joining us from Burundi. She is these days a freelance journalist writing about Africa and Africa subjects and other subjects around the world, but she was for many years the Africa correspondent for BuzzFeed, the Nairobi bureau chief for the New York Times, and in particular throughout this period gained particular regard and respect for her coverage of the Ebola pandemics in Liberia and elsewhere. Jina, glad you're here.
Thank you. Nice to be here. Thank you guys all for making your way back.
Yeah, I'm going to start by reading an opening paragraph from a dispatch of Jina's that I found this morning as I was preparing. This from 2014, August of 2014. In BuzzFeed, the headline, "Ebola is killing women in far greater numbers than men." If you look at this page on BuzzFeed, there's a remarkable photograph by John Moore of a woman named Kona Kupi. And here's Jina writing about her. Monrovia, Liberia. Ebola is killing Kona Kupi, who loved her husband too much. Kupi is 36. Her husband, Alosho Mumba, died of Ebola on August 15th. He'd known he was sick for a week. He'd been calling a national hotline trying to get someone to take him out of his house and into a treatment center. But Kupi didn't know he had Ebola. He had a fever and vomited and shook violently, but he didn't bleed. She worried it might be Ebola, especially with all the phone calls, but she told herself it was something else. Had to be. Where would he have gotten Ebola anyway? All the while, she took care of him, bathing him and feeding him and cleaning up whatever way the disease ravaged his stomach. She was his wife after all. And in ignoring the risks of the disease in order to give comfort, she's not unlike most Liberian women. In fact, the people who see patients and who bag bodies and who respond to calls agree that it's mostly women who are dying of Ebola in Liberia. And this, they say, is why. Jina, I read that because I wanted people to get a sense of how you have covered these horrible pandemics, very much with an eye and an ear for the human impact and community impact. Talk a little bit about how you decided to approach the story that way, and the kinds of, well, where it led you as a reporter?
Um, Thanks for sharing that. I think a lot about that woman actually, and the fixer that I worked with in Liberia, who is a fabulous Liberian reporter named Fala, knew her family a little bit and told me about a year after that she survived. So that was a nice bit of good news for what was a really difficult reporting period. I, like everybody else, I think I was reading about Ebola in Sierra Leone, and the coverage in Sierra Leone and the international press was ramping up, and the WHO was very concerned, and diplomatic missions were getting very concerned, and all the sort of like spaces of officialdom and authority were getting concerned and issuing statements of concern, and there was lots of communication about hand washing and lots of talk about traditional burial practices as if these look different than they look in New Jersey. And I realized at some point that we were all talking about people like they had stopped being people because we were in the middle of a disease outbreak, and instead they had become vectors to be managed or mitigated. And I found that really troubling. That was as far as I thought about it before I got on a plane and went to Liberia and decided, with a lot of faith and help, and probably not just a little bit of fear from my editors too, because I was going to Liberia at a point where there weren't a whole lot of protocols for how to do this well. So with really great support and backing from my editors at BuzzFeed at the time, went to Liberia to figure out what might it look like to do that a little bit differently, and landed in a city that was just at the apex of having to deal with a terrible problem and deal with it totally alone. There wasn't any help for Liberia really in meaningful ways at that point. So it was really a unique and uniquely painful moment. But that meant, as a reporter, that everywhere you looked with that idea in mind, that you were looking for people and not vectors of disease, and you were trying to understand how people were living their lives with this risk all around them, that there was just, as many stories as you could write quickly. And it really became that kind of game. Just how quickly can you report thoroughly enough to support the kind of writing that you're doing, and then churn it out. And my editors were working as many crazy long hours as I was to support me in getting that done. But that was really sort of the mission. And then it became a matter of reading the landscape for where you could find people and tell those stories.
And how did you find this woman, for example, Ms. Kupi?
Fala knew about her. So I've got to think, I honestly don't now remember. I think we were on the lookout for people who had family members who were sick. It was pretty easy to find and to get to, logistically easy to find and to get to, people who were afraid. But people who had living sick people in their houses, or at that time, unfortunately, there were a lot of people who were having to sort of keep guard over corpses until burial teams could get to the house and deal with the body in a way that was safe for everyone. So trying to find people in that sort of like worst liminal moment of their lives, as someone was sick and, with nowhere to go because hospital beds were full, or had died and there was no one to take them away. That was a situation that we were on the lookout for, that I asked Fala to sort of be attuned to. And he got a call one morning and said, we need to go see this woman. And when we were in the car, her husband was alive. And when we got there, he had just died like 5 minutes before. And then a few days later, MSF, Doctors Without Borders, opened their first treatment facility in Monrovia. And I recognized Kona under a tree. And I was with John, the Getty photographer, John Moore, at the time. And so he was able to snap some pictures that we could use to illustrate the photo. And so that part of the story and the illustration sort of progressed over days. But I had one long morning with her in the exact minutes after she'd lost her husband.
When you were approaching folks like Kona Kupi in the midst of this pandemic, you had reported in this country and reported at the local level in Africa before, so you have, general cultural sense of how to make relationships. What was the approach? How did you make contact with people at this, as you say, at the apex of danger, the apex of fear, the apex of grief? How was it different from the way you would usually approach a source?
It was, yeah, it was definitely different. I mean, you try always to be sort of warm and open and respectful and not take anybody's interview for granted, even if the fixer has set it up for you ahead of time, because people can change their minds or they might not feel like it, even if you're talking to them about farming, let alone in a situation like this. It was slightly more logistically complicated because we needed we couldn't, I didn't think it was safe to enter the house. And so making sure that we were able to interview the family, whoever wanted to talk in the yard, while also being aware of the neighbors, being aware of the situation. So I talked that through with Fala about how best to approach it, and then let him manage the situation with the family so that we could approach as safely for us as possible without creating a big scene and putting, neighbors into confrontation. I also remember feeling really torn about whether or not to wear my sort of ad hoc makeshift PPE, the personal protective equipment. At the time, we didn't have the bunny suits and all the stuff you saw in the pictures later that the burial teams had and that kind of thing. But I had gloves and I had some goggles and I had, these kind of things. And I was trying to figure out what the relative level of risk was. And remember deciding not to wear gloves to her house because it just felt impolite. I don't think that was the right choice, but that was the choice that I made at the time. And it was something that weighed on me really heavily, was how can I approach respectfully and safely? What's the balance between my safety and the respect I'm trying to show and how the person I'm talking to is going to feel?
I want to think about the kind of the coverage, and I should say, first of all, to those on Zoom, that if you have questions, begin chatting them in. At some point, we'll go to questions, but use the Zoom chat feature, at least for now, and we'll see how it goes. One of the things that strikes me as I followed your coverage at that time, and as I look back over it now, is that you kept this steady focus on the humane, on people, in what many others were reporting as a medical story. I think part of the challenge over a protracted pandemic is to penetrate readers' compassion fatigue, pandemic fatigue, someone talked about the other day, as well as keeping it fresh for ourselves, right? So we're not just rewriting the same story over and over again. How did you, sort of as you think back on it now, what do you see as kind of the phases of your coverage, and how did you decide, what did you decide to look at which points to try to keep it fresh for yourself and fresh for readers?
That's a good question. So I have sort of always existed in the journalism world as a narrative journalist. That's sort of where my first training comes from, and it's just the way that I think. So my automatic response to a story tip is a news tip is to start trying to storify it in my brain. Who would be the person? What would be the situation? How can you take an encounter, a circumstance, a moment, a quote, and build story out of it? And obviously you can't do that without figuring out how to write about people as people. And so that was a big part of the general approach that I took. And it was, I've been doing it long enough that I have a kind of checklist in my brain. Okay, these are the things that I'm going to need. And it was pretty easy to figure out whether those were going to be possible to find or not. And so that certainly helped. When I first got to Liberia, there was, almost nobody there. There was no real international response. There were no foreign journalists. There were no CDC. There was, but so I went once and then I went again in early October. When I went the second time, like AFRICOM was there, and I was like having breakfast with a general, and you know, WHO had like booked up a whole hotel, and just everything had changed. But at the beginning, when attention was scarce, you know, everything was low-hanging fruit. Everything was there to be written if you just had the time and the stamina. And everything was new to us as readers. When I went back in October, that wasn't true anymore. And the sort of PR people, the spin people hadn't figured that out. They were still offering up the same kind of stories that we would have told in August or September. But I think that the general sort of universalizable idea is remembering that things are dynamic over time, right? No matter what situation you're in, things are changing over time. And so when I went back in October, I had this real visceral, almost embodied notion of what my baseline was for my reporting and my understanding. And I went immediately to people who'd been helpful me to say, what's different now, almost a month later? And that led to a whole host of stories that I never would have imagined, that I think of as kind of advancing the overall Ebola story in a way. A story about Ebola cases actually going down, which we broke much earlier than anybody else understood it. A story about what it was like to be a survivor and go home and find that your neighbors are shunning you, and medical orders are you have to burn everything that you own, and just like the utter devastation of that. And then in connection, you know, people who were trying to help people out with that. There was a support group that had started for folks like that. And so just saying, what's the change from what I know is the baseline was the single key that unlocked so much of that for me.
And that, I mean, and that's something that clearly is transferable to this pandemic, which is going to go on for a few months. And it's important to think about those relationships with sources, not just as quote machines for this story, but as your guides. It sounds like you used your sources as your, in a way, as your fixers, as your guides for coverage, in which you're able to go to them and say, I'm back, what's changed? And that becomes a way of getting out ahead of the competition and of getting important stories that the world needs to hear. Does that capture it?
And I think so. And I think that's in that second visit, I had a kind of credibility and trust with people that newcomers to the story in Liberia didn't have. And that was part, I mean, that's only possible because I was there, you know, earlier in a lot of cases than many other people. But also I think just because of this sort of approach that I took, or that we built up, and it wasn't a choice, it was just a sort of helpless reflex. It really was the kind of reporting experience where your job is to write things down and write the story, and his job is to treat somebody, but somehow you all feel like you're in this same horrible thing together. And everyone shares a sense of each other's mission in a way. Unlike, you know, political reporting or something where there's always that built-in antagonism between you and sources. And I think that made a really big difference too. And which I could imagine being transferable in a COVID situation in terms of just, you know, the doctor who was in your feature on your Sunday living section spread about what it's like to work 24 hours in the ER. Just keep in touch with that guy. Ask him every week how he's doing, and who knows what in 2 months he'll have to tell you, right? That kind of thing. It sounds basic, but these are the kind of things we tend to forget when we're like chasing a frenetic story.
What did you find that your sources, your protagonists, wanted and expected from you at this time? What did they think they were getting by talking to a journalist? How did you handle expectations, if there were any? Talk a little bit about that. What do people want in the middle of a pandemic?
Honestly, my experience was that they just wanted someone to listen to them. I remember before I did the Konakupi story, I met a guy who, I think we just met him on the street, and his sister-in-law had died from a really common complication in pregnancy. And she hadn't had Ebola, but she died because everyone was afraid of pregnant women, because Ebola is a disease of blood and pregnant women are full of blood, and no one was going near pregnant women in early August of 2014. So maternity mortality, for which there were no figures to be gathered at the time, we knew was going to skyrocket. And so we made an appointment set and went to listen to him and his family. And we must have been there for 2 hours, which was more than the story needed, but narrative always needs more anyway. But just that chance to listen, and then our willingness to listen allowed him to lead us to other people who had the same experience, which then allowed me to get the group of people I needed to say, this is a thing and not just an anecdote, right? And just repeating that over and over was really, really helpful. I think when I met Kona Kupi, she needed to talk out loud about like, shit, what was that? Maybe he really did have Ebola, just to say things out loud to people who are willing to listen, who aren't your son or your daughter, who are trying to say, no, don't worry, mom, don't worry, mom, right? I didn't, unlike a lot of other reporting I've done, I had there was no feeling I had of like people hoping that like I might shift the kneel on policy, or maybe more aid would come, or if I felt badly enough, I'd leave $10 behind for medicine for the kids or whatever, right? It just really was a shared experience of shell shock.
How did you encounter any, and did you handle any requests for help from the people you were interviewing? I mean, I was on a phone call yesterday with some of our students at Columbia Journalism School, and they were wondering how to handle the resources question. What do we help sources who need referral to how did that play out for you on this one?
I remember as the MSF facility was going up, the Doctors Without Borders facility was like, they were physically erecting a structure, and they're pretty quick, but it was days, right? So you saw that things were going on. And rumors were spreading in all this. So in a place where there were no beds, all of a sudden, maybe there's going to be beds, or they're going to be 800. What does it take to get to the front of the line? All those questions were coming up, right? So I tried to be as informed as possible by talking to MSF and their PR people about what the process was going to be, and then share that information. And if people had a question that they couldn't get answered, I didn't mind trying to get an answer and sharing that back. I felt like that's also journalism in its own way.
Yeah. Good. No, that I think there are people on this call who will be on this Zoominar who will be reassured to hear that, because there is often some anxiety about how to manage that kind of a boundary, whether it's in the middle of a pandemic or under any other circumstances. What about, and I should say, folks, start chatting in using the Zoom chat feature, which is at the bottom of your screen, to chat in any questions. Let me go back to the personal safety piece of it. What strategies did you use, and how did you manage the sort of personal safety as you went through this coverage? I know you just talked about that choice about whether to wear gloves or not, and that this was not the choice you would have made now. But what were some of the lessons you've taken away that maybe are relevant to this situation?
I mean, my early Ebola days were kind of where I feel like people probably are right now with going into the field to do COVID reporting, in terms of like, okay, everyone says these are the things you should have, but how do I get my hands on them? And my tactic was to improvise as best I could. That's probably the tactic I'd still use. And I've made a sort of like little like village hobby out of reading about all the controversies around DIY masks. Should you, shouldn't you? Speaking of like not reiterating the same story, right? Like that's a story we need to come to agreement on as like a journalism community. We can stop asking the question and like let people move on with their lives, instead of constantly contradicting each other with like who knew what because they heard it on NPR this morning. It's really driving me nuts. But I think that like, come to a decision about it, make a decision about it, and be as informed as you can, while knowing that like there is no such thing as perfect information. And there is no such thing as perfect process. There's also no such thing as perfect risk mitigation. So we talk a lot about in the language of prevention, right? But what we're actually doing when we go into these circumstances, whether it's Ebola or COVID, is trying to mitigate risk for ourselves, but also for our sources. And I always found it much more helpful. There are do's and don'ts out there. There's lots of do's and don'ts lists right now about how to report about this. There were those on Ebola too. But I found it more helpful to sort of reverse engineer from notions of do's and don'ts, ways I should be thinking about risk, how I should be visualizing and anticipating, and what I should be looking for to practice risk mitigation in a circumstance that I might walk into. Because no do's and don'ts list is going to come up with every possible thing you might walk yourself into, right? You need to be practiced at the reflex of the thought process more than having memorized a chart of what will work and what will not.
Yeah, and I think this is this has come out of several conversations that I have had in the last week. The emphasis needs to be on minimizing risk. We're going to be unrealistic and also, in a way, maybe become desensitized if we just deal with, if we try to say, what can we do that's no risk, then no journalism will be done. The question is, are we minimizing risk to ourselves, minimizing risk to our sources, minimizing risk to the community? And what does that look like and mean? I think that's good. Here's a question from Lenka, who says, if I'm not mistaken, the human, your character, Kona's personal changes were the core of this article and of some of the other ideas that you suggested. How do I make sure that one story, and I think here Lenka means an individual story, accurately is projecting a trend? Should we ask several people, or are we doing how do we decide? Now this is not Lenka's language of language. How do you know that one story is actually representative, that you're doing the responsible thing? Do you try to back it up with similar stories that make a pattern? How much back reporting do you do behind an individual exemplary story like that?
Yeah, it's a good question. Before I answer, I want to say one more thing about safety. The other thing that I learned doing Ebola, which was really important, was that part of what keeps you safer or allows you to minimize your risk more effectively is a sort of heightened sense your brain has of being on in the reporting scenario, right? Like a feeling that you're entering a kind of dangerous environment, all your reflexes perk up, you see things more clearly, you're more attuned, all of that. That doesn't last forever. And it's much easier to turn on almost naturally when you're in an environment that is foreign to you, and rather than when you're reporting at home. So this kind of like heightened psychological awareness is something that I think we need to pay a lot of attention to. It's much harder to be aware of that in places where we otherwise live and work. And it's much harder to keep that working for ourselves in the long term. It gets really easy for that to sort of quiet down, and then we slip up and then we have a problem. So just wanted to sort of flag that, the other side of safety thought that I had. In terms of Lenka's question, I think in one sense, I would encourage us just to think of this as ordinary journalism. We're probably, especially people who are staffers, are experiencing an extraordinary degree of pressure to churn out stories right now, for sure. But the relationship between, for lack of a better way of thinking of it, let's call it the anecdotal lead and the body of the story, or an individual and a trend, is the same in a COVID story as it would be in a fashion story, right? Like, when do you have enough examples to make a trend and not a singular case? And that's largely a matter of conversations between you and your editor, I would argue. But for me, I certainly interviewed, bunches of people before I would say, here's what's happening. One man whose sister-in-law died in childbirth because doctors wouldn't answer the phone and deal with her problem is one guy. 12 people who had the same experience, now we have a story. By the time I got to Konakupi, I'd been around for 10 days, so I knew that her story looked exactly like so many other things that I had already reported about. And when I was there in October, one of the stories that was open to me, because I was thinking about phase 2 and had these resources already and these relationships already, was about Ebola cases actually going down. And it was a doctor whose job it was to track Ebola cases who told me that. And I thought, oh, geez, I could write a story in which the doctor's the main source. And that's a legitimate story. But that seems like it's going to open more questions than it resolves. So what I ended up doing was reporting to see if that was the same across the spectrum of people who would touch an Ebola body, from a body in a bed to a body in a bag to families to ambulance calls to the hotline, I think I found 11 points of connection between that question and what I thought was enough like definitive information to write a story that was that singular, which is another way of saying the stakes of the story matter too, right?
Well,
Again,
and
that's
there's,
a call to be made between you and your editor, but that makes a difference.
Yeah, and there's a couple of ideas, also specific ideas embedded in there. One is simply this idea of how many hands touch a body and at what phases, thinking about that kind of the work process that is involved in people responding to a pandemic. What is the actual workday of a mortician? What is the actual work day of a nurse, of a floor cleaner? But also, what is the actual experience of an individual, of a body? Like, thinking about it as work process strikes me, what you're saying is a very powerful way of engaging with this kind of pandemic story. And also thinking about what changes when the tide turns, and just thinking about planning for when the tide turns. What are some of the things that you noticed about when the tide turns that might turn out to be relevant lines of inquiry here?
So you put the question just now as what changes when the tide turns. I would start just with the question, what changes? And my next question would be, what does that tell me? And neither of those are questions that I myself answer, right? I might have a hunch, but I go immediately from what changes, good, thank you, to who can tell me what that means, right? Sometimes that source is the same person, sometimes they're not. But it's easy to get tripped up in, especially in like just the deluge of news that there has been on coronavirus, where everyone's some kind of armchair expert now. And like, it's really easy to think that when you hear about a change, you know what it means, right? But going the extra mile and convincing someone who has 7 other calls on their call sheet, talking to journalists, asking the same basic questions, it's not easy to do, right? But what changes and what does it mean? Who can tell me what it means? Okay, and then do I have enough here to uphold the bigger idea? I think, how do you plan for when the tide turns? I'm not sure I know. I had an idea and it slipped out of my head. So let me tell you instead. Let me write that down and tell you instead one other thing I was thinking about as you were saying that. I think constantly in any story I'm doing, just the way I am, I can't help it as a journalist, is I think about how to see a system. There's a big system involved, whether it's like how economic power is projected or how an Ebola body moves through the chain from sickness to death in Liberia. And where can you draw from that abstract system, draw lines down and find real people? And then who are those people and what can they tell me? And that dialectic between system and people is where I think the real stories are. The stories, and I don't mean the real, what I mean by that is the stories that last, that readers remember. And I think that's also like something I feel like I need right now as a reader of coronavirus stories. I'm getting a lot of these individual dots down here, and I'm getting a lot of this up here. We don't have enough beds, the money isn't moving, oh my God, ventilators, right? I'm not getting a lot of this. And I think that's what readers understand and can connect to and can help them make sense out of what the heck is going on around them. There was a really good story yesterday that's an example of that, I think. Planet Money did a story about manufacturing ventilators, and they went inside a plant trying to work with GM to increase ventilator supply. But it really crystallized and narrativized this problem of we don't have enough ventilators and how do we get them? Stuff like that moves back and forth between the sort of like earthly realm and the ethereal realm, the abstract realm, I think is where the magic is.
Amira has a kind of an ethics question, which I've heard certainly some of my students at Columbia asking as well, and some other reporters, which is, in the middle of a pandemic, how do you deal with the dilemma, with the perpetual ethical question of, am I taking advantage of the misery of others? How do I balance my own career goals with the very difficult situation in front of me? How do you, as Amira says, how do you pass that mental blockage? Because it is something that can trip a lot of us up. How do you think about that one?
Yeah. I mean, the first time I did the first trip I made to Liberia to report on Ebola was like almost a kind of trance. There's also a question in here about like self-care while I did that. I was terrible at it. I worked until I slept. I got up, I worked again, and I dealt with everything else 10 days later. And then 10 days later when I got, or 12 days, whatever it was, I forget how long I was there. I tried to figure out how to deal with the self-care stuff. But all that is to say, like, you're in this sort of heightened tunnel vision place, right? And I think that, you know, when you go there that you're about to deal with all this misery. I found in stories that also are not as of interest as the Ebola work that I was doing, that are about equally sad moments in people's lives, that there's people experience, the sources that you talk to have two experiences of what journalism is and whether or not it's exploiting that misery. One is what you write, and different contexts govern how likely it is the people you write about are to see what you've written. That's one thing, and that's the thing we tend to think the most about. I think the thing that's actually most important to the people we're talking to is the experience they have while they speak to us.
Yeah.
And for most of the people that I have interviewed in my 15 years working in Africa, that's the only experience they have of my journalism. My story doesn't make it back to them in their language. And that, how you handle that encounter resolves or does not that question in a lot of ways. If you know, opening listening encounters can leave people, even in the depths of great misery, feeling heard and seen, or feeling that their loved ones mattered in some way, or that their own experience matters in some way. And that's tremendously important. That's different than the sort of voice of the voiceless bullshit that we talk about at award ceremonies. This is like a real important relational thing that does exist for someone in the world and matters. And for me, that's where the resolution is.
I'm going to paraphrase a good question from Ephraim, who is thinking a lot about local journalists in crisis areas, which now are coronavirus areas,
all of us,
who don't have the resources of big Western news organizations, or even modestly sized Western news organizations, who are being pressed by their bosses to go out and report amid health danger, and there's a reason to do it too. What would you say are the most effective self-care and safety strategies that local journalists who feel under tremendous economic pressure, particularly in places where you're being paid by the story, or where there are other kinds of economic pressures like that, people want to protect themselves and their families, they also need to go out and report. What should they be doing?
Yeah, I mean, this is a hard one. I think I've also been fielding inquiries from reporters in well-resourced Western news organizations that are not doing the kinds of things you'd hope they might be doing, and their reporters are feeling similarly pressured. So I think this is much more universal than we might like to think that it is at the moment. And at some point, you know, the long and the short of it is that at the end of the day, how responsible you are as a reporter is up to you. You have to be the one to figure out how you're going to manage that for yourself. And there are super easy, super cheap ways to make DIY masks. That's thing number one. And I would not be in the world reporting right now without one. I also would not be a source talking to a journalist who wasn't wearing a mask either, by the way. But, you know, that's one thing. Carry, you know, hand sanitizer around the world. Who knows what the market is? Can you get a hold of alcohol that's proof high enough to make it for yourself? You can resolve those questions, but you can walk around with a bar of soap, and somewhere, somehow, you're going to find a little bit of water. Whatever it is that you can do for yourself to be safe along the journey, and then establish a protocol about what you're going to do when you get home to be as safe as you can before you enter your home. Those are the things that you need to be doing.
And that can include things like changing your clothes outside of your own home, right? I mean, people, like a number of medical professionals whom I know, are changing into their home clothes, either at their front door or even back at the office, leaving work clothes at the office and completely safe clothes coming home. Those kinds of things can happen. And again, let me remind folks, use the chat function to send in questions. When you and I spoke a week ago, I think I can share this, you were in quarantine. You had, Jina had somehow bullied her way onto a series of airplanes, got herself back to Burundi, and then was quarantined for, I think, 14 days. Having now done that, and without giving away anything that you are working on and having a scoop on, what are some of the stories we might be thinking about the shared experience of quarantine? You now have been there, done that. And it's certainly one place that's waiting to be fully mined, the question of what self-isolation does. In that period of quarantine, what was your own self-care package? But more importantly, what do you think some of the stories are, some of the points of interest for reporters in this part of the story?
So my experience of quarantine is different than your experience of quarantine or self-isolation, because I was forced into a hotel room by the government before I was allowed to go home. And like, our hotel was monitored by men with weapons. So it was one of those scenarios. And, you know, everyone was sort of as friendly as we could all possibly be, while looking at each other and wondering who exactly it was who was going to be the one who brought the disease into a country that had no cases. So it was a weird little psychological space. I don't know how many places are running facilities like that. Kenya has been quarantining people who are coming back, but also allowing them to go home on a promise of self-isolation if they sign a paper and that kind of thing. I'm not sure how many people, how many countries.
I know a number of places have. I mean, even in the UK, at Heathrow Airport, one of the big hotels near Heathrow has been taken over as the COVID quarantine hotel for people who have fevers coming off of airplanes. So
oh wow, I have no idea.
The Holiday Inn at Heathrow, for anyone who's looking for a story in the UK. I think there probably is a story in those hotels that are being used as quarantine facilities.
Well, this is another good example of sort of like, how do you see a system and where can you tag it to a person, right? So who's in there? Obviously, people like me are in there, right? And I don't actually think we're all that interesting. We're all just trying to get home or do whatever it is we're trying to do. But, you know, we had people cooking for us. We had a guy at the reception desk. We had security guards. We had doctors who took our temperatures every morning. And they were all quarantined with us. They couldn't leave either. What was happening for their families, what was going on, how many of them had advance notice of being asked to stay in the same facility as these potentially, deadly disease bombs that were coming into the country. How did they feel about us? I was never brave enough to ask. There's lots, there's a microcosm of sort of like system to stories you could probably do there. One thing I would be looking at if I were in the States right now is, and looking for an angle on healthcare. I feel like since you and I spoke last, Bruce, we've seen kind of a rise in attention to health workers and stories about the psychological strain, the physical strain, the risk that health workers are facing. There's also, I've been hearing little rumors from people who are in various spaces, that some hospitals are starting to reorganize their staffs. And there are doctors who are seeing layoffs in the middle of this, healthcare workers who are seeing work cuts. There was someone on NPR who was fired or laid off or some such thing for wearing his own mask. And then when the story came out, the healthcare facility said, oh, no, that was actually about cuts, but he's been reinstated. And I thought, who in the world would be cutting healthcare workers at a moment like this? So those questions remain relevant,
There are some wonderful stories to be done, I think, important stories on how for-profit healthcare enterprises are treating their own employees. Patch, New Jersey, had a very interesting story this morning about clerical and other kinds of non-frontline staff at one of the big New Jersey healthcare providers, hospital providers, who were being forced to come to work and were scared of it because they're not essential people. They could work at home, but yet the company was demanding that they come in. Let me ask you, I'm going to ask one other question from the room, from Georgia, and then I've got one that I'll end with, and and then we can all get on to lunch or dinner or whatever our time zone demands. So Georgia Gee says, I'm reporting a lot about the intersection of religion and corona. How do you navigate hearing about people who are potentially harming themselves by exercising religious belief with not wanting to either overstep and actually say to them, why are you doing this? How do we think about the relationship of faith and pandemic? And this was something you would have encountered for sure in the past, yeah?
Yeah, faith, or on the, or even if not formal faith, utter distrust, and all the sort of beliefs and magical thinking or other things that can be introduced, or that one introduces to cope with a vacuum of certainty. I think you deal with it the same way you deal with it in non-pandemic times, right? You report as fairly and openly and honestly as you can. You don't shy away from hard questions. And, if you're really feeling the tug toward, oh my God, I can't believe your church is still open, are you freaking out of your mind? You create a question out of it that's as respectful as possible. Are you concerned about the stay-at-home orders? What would you say to people who see a contradiction between the stay-at-home orders of the governor and your continued church services, or whatever it is, right? You find a way to raise that question as respectfully and, objectively or neutrally as possible.
Yeah.
It's not.
And what about,
this
this is something that's certainly coming up in the US, but will be coming up as well in other parts of the world. What about do we report on the kind of motives of faith-based medical aid organizations? This is coming up in the US, where one big evangelical group is building the tents, is going to be staffing the Central Park Field Hospital. But it happens in other parts of the world where you have missionary organizations who are providing crucial health care as part of a faith-driven mission. How do you engage with that? How do you think about it particularly during a pandemic crisis?
Yeah. The first responders to Ebola in Liberia, which started in the northern part of the country that borders Sierra Leone and not in the capital, which is further south. The first responders there in the northern part of Liberia were Samaritan's Purse, who are just overtly, even more than like World Vision or something, quite religious in their approach to their work, or religiously driven. And, I don't know. As a person who's not generally a religion reporter, and in that situation in Liberia, because an American doctor got Ebola there, and like the story had legs for a while. I just sort of put the religion bit to the side. Does it matter that these people thought they were here for Christ at a time when no one else was there? For me, it wasn't material one way or another to what I was working on. But certainly in other ways, there are questions to be asked, right? And I think you have to follow those questions like you would any other questions as a good reporter. As private health facilities start to come up with guidelines about what they'll do in terms of allocating scarce resources, I'm talking around the idea that health facilities are starting to make rules about who gets a ventilator and who doesn't, right? If you're in a Catholic hospital and you're a Buddhist or a Hindu or a Sikh who comes in a head wrap, what happens? Is the facility even starting to think about that? And of course, they're going to have certain things that they do say, and then they're going to have other things that you can look at and track and whatever to see how much it all lines up. But that would be a material question, it seems to me, right? In a way that at the Ebola time, it wasn't to me as material.
Right. So let me ask you one other thing that takes us back to your Konakupi story in a way. You, in covering Ebola and in much of your work, have tried to keep special focus on how these kinds of events affect women and keeping women at the center of your coverage. As you look at pandemic now, the coronavirus pandemic, and thinking about stories that need to be done, and what advice would you give to reporters who want to be looking for that special, the gender divides in impact, and looking at the special impact on women or other identity groups, right?
Mhm.
How do you think about a generalized story like a COVID-19 pandemic and say, what's different for women in this? What are some of the pathways to that?
Mhm. So this is similar to the operating question being, what's my baseline and what has changed? I think questions about these sort of disaggregated groups of humans are what's missing, and what does the fact that it's missing, what might the fact that it's missing tell us, right? So on the gender angle, I think the approach is, thinking about categories of people we're dealing with. Let's say healthcare workers is super obvious, right? What's the gender breakdown of jobs in a hospital, and how are those people faring right now, right? Doctors versus nurses. And is there, when there's no PPE, who gets what, right? According to what hierarchy or system of values, and does that track or not to gender differences that we see? So data tables are your friends, like the baseline demographic data tables about all of these different questions. One thing that I have been I can't believe that we don't have this data. There is not data about COVID deaths by race. And we know that African-American communities suffer chronic diseases that increase the likelihood of complications from COVID at far greater rates than white Americans do. And we simply don't know whether or not that's affecting these outcomes. And to the earlier question about like, when do you know you have a story and not just an anecdote or like one idea or not? I first started to pay attention to that because the early obituaries I was seeing for the people, the non-old people, right? Like people in their 30s, were all Black women. They were coming across my TL from women, principals in Brooklyn, women in London. And so I went looking for the case data. I was like, I wonder if this tracks. Why are Black women disproportionately represented on my news feed of people who are in these younger deaths? And then of course I was, I know, because I've done a lot of health reporting. I know that there's, these, the baseline for this community is that their health outcomes in general are going to be worse. We don't have the data. And why don't we have that data? It's not that hard to collect. So, I mean, there's probably 6 stories in what I just said, but the sort of like the tool, the sort of like reporting approach there is what's missing, what does the fact that it's missing say or might say, and why might it be missing? And what does that tell us about who's not doing their job?
Thank you for that. I think that's as good a place as any to wind up this conversation. I want to thank you, Jina, for being with us. Susan Kaplan, who's in the background preparing tip sheets, Ariel, Richard, and Kate Black, who've been driving the board and keeping the Zoom bombers out of the room, and all of you for questions. This will be edited and posted to the Dart Center's website eventually, where you can also find the previous conversations in this series. I want to thank all of you for your reporting, all of you for being here. Thank as well our partners at Columbia Journalism Review for helping get the word out and suggest ideas for this series. We'll be back next week with some more conversations, as we will be for the duration. Thank you all.
Thank you, everyone.